Nigeria's National Health Insurance Scheme, the NHIS, a body that regulates health insurance affairs, has intervened in an ongoing dispute between HMOs, health management organizations, and healthcare providers. The HMOs, as the Healthcare Providers Association of Nigeria, has threatened to cut off services to enrollees under private insurers by today, January the 31st, citing losses that were accruing to members due to poor tariffs paid and a pile of debts that are being owed. So joining us to discuss further, Ugo Nwokoro, who is a co-founder and CEO of swiftmedispark, which is a player in the medical sector. Ugo, thanks for joining us. Good morning to you. How would you describe the challenges that HMOs in Nigeria are facing presently?
The challenges that they face are mainly financial, right? So they're facing a lot of late premiums being paid to them. So there are customers who are meant to pay them annually for health coverage of their employees, usually tend to pay a bit late. So they're receiving premiums 6 months, 7 months late. And then this issue transfers over to the hospitals that they have to retain. And it's not so easy. HMOs can't just drop employees and stop their enrollees accessing healthcare. Neither can they lose customers, because there's always one other HMO that's ready to take on those customers. So they're having serious cash flow issues, and it's ending up affecting the ability for those hospitals to deliver care to their patients.
Thank you. So do they have a case? Do tariffs need to be raised? And if so, what's the impact? Is it higher costs for folks who are trying to get healthcare?
Yeah, well, the hospitals do have a case, because we're talking about managed care here, right? Managed care, the intention of managed care is to reduce the cost of delivering that healthcare as much as possible. So the hospitals are being squeezed to accept as little revenue as possible. So it's causing them to not be able to offer healthcare as adequately as they want to. And then again, with the rising costs, like the cost of the poor exchange rates in Nigeria, and the brain drain that we're currently having, where doctors are all leaving and having to pay doctors more and more just to stay, it's causing these hospitals to not be able to run profitable businesses anymore. So yes, there needs to be an increase in tariffs, but there has to be another conversation had about how that will be affordable for the HMOs and the companies that they represent.
Thanks. And speaking of affordability, what needs to be done to scale universal health insurance across Nigeria? Well,
insurance just needs just better penetration, really. I would say the main thing is adoption by consumers. Mostly right now, HMO customers are mainly companies, corporates. They have corporate business, really good corporate business running. So loads of companies are putting their staff on their HMO care. But you hardly ever hear of individuals who just buy health insurance for them or their families directly. And I think in Nigeria, we need to get to this point where it's a status quo for everybody to have health insurance. That is where we'll be able to see better coverage, because obviously it's an insurance business. The insurers, the HMOs, will have a lot more capital to be able to pay the hospitals better, as long as everyone doesn't fall sick at the same time, like COVID, of course. But that's the only way we can achieve better healthcare coverage across Nigeria. It's the same in the US or any other parts of the world.
Okay, I guess you play in the software space where you digitize medical records for hospitals. How important is that, since we're talking about reducing costs and increasing efficiency? Digitizing hospital records, what's the impact as far as efficiency and cost reduction is concerned?
Okay, so on the efficiency side of things, that's one major benefit. So you can see hospitals have it like a lot of traffic, a lot of patients coming in every day, right? So on average, a doctor may be able to see 5-10 patients a day if they're fast. But with more efficient digital records, they're able to access patient records faster, make better decisions quicker, send the patient to other departments of the hospital much quicker than they would normally. You can see we can see that number increasing by 10x, where we see a doctor is able to see up to 100 patients a day because of that efficiency. And this cost saving works out a lot better for the HMO. That efficiency is what HMOs want. They want more, doctors to be able to do a lot more work for each dollar that they pay them. So on the efficiency side, that's one major thing. But software also helps with better distribution as well. One major way we can achieve healthcare coverage in Africa is if the healthcare system is kind of tiered, right? It's separated into segments where you have primary care and secondary care, better separated. Because 90% of cases are primary care, right? It's just normal cough, catarrh, malaria that you and I have every single day. You don't need to sit down with a doctor with a consultation and go to the laboratory and all that and use the extended services of the hospital to be able to get care for that. So what tech helps us do is to separate those patients. So those primary care patients can be attended to either virtually through telehealth systems. There even today, companies like Reliance HMO, they have a chat system where you can just chat to a doctor and the drug is prescribed right there. So it's a lot more efficient. And then the serious cases then are the ones that go to the hospital. This allows prices to drop significantly for every time a patient accesses care.
Thank you so much for that. I want to move to the Pharmaceutical Society of Nigeria. Why the emphasis on a reconstituted health sector reform committee?
Yeah, this is a problem that's going on for a very long time, and it's not just the pharmaceutical body. It's most organizations within healthcare. Doctors are overrepresented. When we think about medicine, that's what we think about. This is my doctor or my doctor. Everybody thinks about doctors. So doctors seem to be the ones being considered first for anything. Just look at the current situation in Nigeria. All the commissioners of health that I know of in my lifetime, and all the health ministers that I've ever known have been doctors. We've never seen a pharmacist be the commissioner of health. We've never seen a sonologist step into that position ever. We've never seen a radio diagnostic expert be, represented in that position. So the policies and health reforms are always skewed in favor of doctors, and this is what this organization is fighting for.
Thanks, Ugo. I think you mentioned brain drain earlier on when you were talking about in an answer to one of my earlier questions. How bad is that for Nigeria right now?
Damn, Roses, I wish I had numbers to give you, but I would say it's very, very bad. I work directly with a lot of hospitals, and they are telling me that they are recruiting at the rate of about 4 or 5 doctors every month. That means 4 or 5 doctors are leaving their hospitals every month. There are about 26,000 hospitals in Nigeria operating right now. So if you multiply that number by 5, you can guess the amount of people that are leaving the country that quickly. It's in the hundreds of thousands. It's terrible. And what it's causing now is that the doctors who stay behind can demand a lot more money. Not that they can, they are demanding a lot more money. You are having hospitals that are trying to having to multiply the current salary for doctors by 3 or 5 times. So it's causing them not to be able to run profitable businesses anymore. Again, causing a lot of pressure on the HMOs. I really don't know what Nigeria can do to fix this problem, because I know it's not a healthcare problem as a lot of people think. It's just a Nigeria problem. I was talking to my friend the other day where I said, if this exact same thing happened where there was demand in foreign countries for people in finance or in banking, they would wipe out Nigeria's banking sector easily, because the problems that they face are not unique to medicine. It's just the living conditions and the poor salaries in the country, lack of safety, all the uncertainty with the future of the country and all that is encouraging people to leave. So yeah, it's a really big problem.
Thanks, Chuka. Ugo, we've got about less than a minute to go. Outlook for 2022 on healthcare, the medical sector. How do you see things playing out this year?
Well, I'm an entrepreneur, so I always see things in a positive light. If wherever there are problems, there are opportunities to innovate. And Africans have never been, we don't slow down with innovation. We want to make things happen. We have a lot of entrepreneurs, smart people in this industry. I see a lot of tech coming into the industry. I see a lot of necessary reform that needs to come in, and a lot of young entrepreneurs that will come up with solutions for these problems. They might not be easy and they might not take a while, but I think positively this 2022 we will see a lot of growth in the healthcare sector.
All right. Positive way to end the show. Ugo Nwokoro, co-founder, CEO of swiftmedispark. Thank you so much for joining us to talk about the healthcare sector in Nigeria. Appreciate your insights.